An Alberta family says our healthcare system is failing after their partially paralyzed father was placed in a motel instead of long-term care. The health minister says proper discharge policies were followed. The family and the official opposition are demanding the province provide better care. Shaylan Skulski reports.
I was shocked and in disbelief.
That was Gila Manyapik's reaction to learning her 62-year-old stepfather, who was left in a wheelchair after a stroke, was being placed in this Leduc Travelodge motel instead of long-term care.
The doors were too heavy for people in wheelchairs to open by themselves. The ramp at the front door was too steep for people in wheelchairs to use by themselves, and the bathrooms were too small to be able to transfer someone on and off a toilet.
The family says they were told Blair Caniff would be going to a long-term care home through a program run by Contentment Social Services. When asked how and why this man ended up in a motel, Alberta's health minister had this explanation.
And the patient ultimately, when they are able to make decisions, makes those decisions, and that's my understanding of what happened in this particular case.
I'm not surprised that they said that to cover their steps, because it was a nightmare situation.
The minister says there was a miscommunication between Alberta Health Services and the nonprofit group responsible for Caniff's care.
I would question that nonprofit provider, why they thought this was an appropriate site.
CTV News reached out to Contentment Social Services and have yet to receive a response.
A senior should never be sent to a motel to receive their care from someone who randomly pops by.
The Alberta NDP is asking the minister to share how many other acute care patients are being housed in motels and how often this company is used by AHS. A spokesperson for AHS says hospital beds need to be used for patients with acute care needs, adding, community nonprofit organizations exist to support the needs of community clients. AHS works to connect patients with these types of programs. The health minister's press secretary says the ministry is working with AHS to examine their discharge policy and ensure patients are accessing the right services in the right place. Blair Caniff is back in hospital with no timeline to get into long-term care. Shaylan Skulski, CTV News, Edmonton.